Okay, we're going to get started. Thank you all so much for joining us, and welcome to the first virtual Canterbury Town Hall. I am Catherine Bangle with Bangle PR, and over the last year, we have been assisting Canterbury Foundation, gathering positive stories inside Canterbury and sharing them on their social media channels, so we hope you're following along there. We also curate the Canterbury Foundation blog, so we hope you tune in on their website. And then over the last few months, we have been assisting Canterbury with communications around COVID-19. Our goal has really been to keep everyone from staff, residents, resident families, and even community members up to date with the latest and most up-to-date information that we're getting from Alberta Health Services and the Alberta government as it relates to restrictions and requirements inside Canterbury Foundation. So today we wanted to give you the opportunity to ask questions as restrictions start to lift in the province, in our city, and slightly inside Canterbury. We wanted you to have an opportunity to chat with our panelists who we have here today. Now, today's town hall is strictly to talk about the relaunch. If you do have questions about the capital campaign or construction around Canterbury, we welcome those questions. I will encourage you to send them to our email. It is community@canterburyfoundation.com, and we will get back to you with answers for those. But tonight, we have Wendy King, the Executive Director of Canterbury, outlining the relaunch strategy for you. And then you'll have an opportunity to ask questions after her brief presentation. And with her tonight, if you have health-specific questions, we have Heidi Hadubiak, the Director of Canterbury Foundation's Health Services. And if you have programming questions, we have Mambalia Carrera, the Manager of Resident Experience, who can answer those types of questions. Now, for those of you joining us on Zoom, you'll have an opportunity to type in your questions on the Q&A function. We won't be opening it up to verbal questions tonight. If you are joining us on the phone, welcome. Again, we are monitoring the community email for Canterbury Foundation. And so you can send in your questions there, and I will get them to our panelists to answer live tonight. So you will each get one question. If you do have a follow-up question, again, you can either, hopefully they get answered over the time of our town hall tonight, but if not, you can again send them into that community@canterburyfoundation.com email. So without further ado, I want to introduce Wendy King. She is the Executive Director of Canterbury Foundation, and she is going to be outlining our relaunch strategy at Canterbury. Wendy, can you unmute yourself?
Okay, can you hear me now? I'm okay now? Okay, good. Thank you. Thank you everyone for joining us tonight, and good evening. Thank you to residents, families, community members, and elected officials for joining us tonight. We appreciate all your support over the many years, especially the last few months. And we thank you for your patience as we manage the COVID-19 situation. I know this has been a trying time, especially for our residents who, to put it simply, have had restricted independence and have seen less of their families than usual due to the province's strict guidelines. I know this has been challenging and will continue to be so for the foreseeable future. But because of our diligence in screening, restricting visitations and outings, and following all of the chief medical officer orders and protocols, we have had not one case of COVID within our walls. We are grateful and proud of our staff and of you, and we ask you to continue to be vigilant as we begin our relaunch phase. Our goal is to get through this without a single case of COVID-19. It's up to all of us to take that responsibility seriously. Currently in the province, 144 of the 149 COVID-related deaths in Alberta were in people over the age of 60. 115 of those were in continuing care facilities. Thankfully, only 2 sites in Edmonton have had cases. This is why we have been vigilant and taken our lead from AHS. To give you an example provided by Dr. Hinshaw of just how fast COVID-19 can spread, 2 weeks ago, as Alberta began its relaunch, 2 families in Edmonton held private family get-togethers that included the sharing of food. This resulted in 10 new cases of COVID-19 in one family and 8 in another. This demonstrates how the virus has the ability to spread quickly when we don't practice strict precautionary measures. It is imperative that residents remain vigilant in their actions to protect themselves and others around them from COVID-19. I want to clarify that the Court, the Lane, and the Manor are all licensed supportive living sites. This means that Dr. Hinshaw's orders do apply to the Manor. Many feel it is an independent living site and therefore should have fewer restrictions. I know that many Manor residents are struggling with this. We understand, but we are required to follow Dr. Hinshaw's orders in the Manor as well as the Court and Lane. You will have received the details of the relaunch strategy. Please note that should Canterbury be under investigation or have a confirmed COVID-19 outbreak, the listed relaxations in any of our phases of relaunch will no longer apply. If such a situation occurs, residents and families will be notified immediately. If you have not done so, please ensure you are on our email distribution list for COVID-19 updates. You can submit your information through our website. Our phase 1 relaunch plan began on June the 3rd. Here are some of the lifted restrictions. For residents, visiting with other residents within suites is now possible. However, you must still maintain physical distancing between each other for the entire length of your visit. Hand hygiene must be performed prior to entering a room and immediately after you leave. Do not share food, utensils, or game pieces such as card or remoli. Do not visit anyone on precautions or suspected of COVID-19. Visits between residents in the Manor and the Court are not permitted. When it comes to programming, program capacity has increased to 15 people, including the life enrichment team member facilitating. Social distancing must be maintained. Word games, trivia, movie nights, courtyard game visits, and walking groups will not be allowed. Exercises will be allowed, however, dumbbells and exercise bands are still not to be used at this time. The beauty salon is open. We recommend you choose this service rather than attending a salon outside of Canterbury. Foot care services have resumed. Scheduled outside visitations have now been expanded to include the weekend. The designated essential visitor or resident with computer access can schedule the bookings online. We are also relaxing the requirement that the designated essential visitor must be present for each visit, as we understand this may not always be possible. For window visits and courtyard access, both courtyards remain restricted to resident use only. To further support interactions with visitors, residents and their families can book a window visit by contacting the Life Enrichment Department. A deck has been built by Stuart Olson outside a suite in the Court and Manor to support the visits for external visitors. Residents engaging in a window visit will remain in the suite. Virtual visits by FaceTime, Skype, or Zoom are available and can be booked through the Life Enrichment team. When it comes to resident outings, we know that residents are anxious to leave the building, especially those living in the Manor. However, we're still encouraging all residents to stay on the property and not participate in any unnecessary outings. Any outings other than essential appointments are not recommended, as per Dr. Dina Henshaw. To remain COVID-free, everyone needs to take this seriously. We all have the responsibility to keep everyone safe. But it is your choice to leave the building as activities open in the community. If you feel it is essential for you to go to activities or appointments in the community, It is your responsibility to ensure you are following these precautions. Observe physical distancing by keeping a distance of 6 feet or 2 meters between yourself and others. Wear a mask at all times and ask anyone you may be with to also wear a mask. Ensure safe transportation as follows: that the vehicle has been cleaned and disinfected with a focus on high-touch surfaces. The driver and all passengers are masked. The driver and resident and other passengers sit as far as possible and minimize the number of passengers. Wash your hands frequently and avoid touching your face or mask. Use hand sanitizer immediately upon returning to Canterbury. Check in with reception in person or by phone to undergo a health screening, including temperature check. For external interactions with family or loved ones off-site, outdoor visits are preferable. Observe physical distancing requirements. Wear a mask at all times and ask anyone you may be with to also wear a mask. Do not share food or beverages. Ensure safe transportation. Wash your hands frequently and avoid touching your face or mask. Use hand sanitizer and undergo a health screening assessment upon returning to Canterbury. While these activities are not recommended, we will be diligent with our enforcement. Guidelines around physical distancing and mask wearing are required. Self-assessment. Residents who do not receive home care on a daily basis are required to perform a daily self-assessment. You can find the self-assessment form for reference on our website. If you have any listed symptoms, self-isolate in your suite and contact health services. Gatherings. Gatherings of more than 15 people are not permitted. Gatherings of 15 or less must follow physical distancing. There are no changes to visitation within Canterbury in this order. A 14-day isolation will be required, and testing for COVID-19 is strongly encouraged for the following: if you are symptomatic or have tested positive for COVID-19, have come into close contact with someone who has COVID-19, if you have returned from hospital, if you have returned from a temporary relocation for a period of 24 hours or longer, for anyone moving into Canterbury. Please note, a negative test does not take away the requirement for isolation. Recommendations: all residents, and especially those with pre-existing health conditions, should limit contact with people outside the facility and stay within the facility as much as possible. If you do go out as a necessity, do so carefully. It is important to wear a mask, practice good hand hygiene and physical distancing. For our phase 2 relaunch plan, we do not as yet have a date, as it will depend on the success of phase 1. Lifted restrictions. The Canterbury coach service will restart for leisure drives only. There will be no stopping at businesses or other public places. Happy hour service will reopen with all relevant precautions being followed. Church services with Canterbury's chaplain only will be available. All phase 1 restrictions and recommendations will remain the same for phase 2. Phase 3 will be determined later. Lifted restrictions will be limited numbers of visitors will be allowed entry according to the Chief Medical Officer of Health order, or a discontinuation of the public health orders for licensed supportive living facilities. External companion and housekeeping services can resume. Entertainment and vendors will be permitted based on space and capacity restrictions. Coach outings to businesses will resume. Internal library reopens. All faith services will resume. Full access between court and manor buildings will be reopened. Continuing restrictions, screening of all visitors into the building will continue. Gatherings of any kind will be based on capacity guidelines from the Chief Medical Officer of Health. Physical distancing restrictions will be maintained. Mask wearing will be enforced for residents and visitors. Residents must continue to self-isolate when feeling unwell. Restrictions will be reinstated in the event of an outbreak as mandated by public health. Deliveries. We ask that wherever possible, families arrange for delivery drop-off and pickup before 10 a.m. and after 3 p.m. During peak hours, our reception team has less ability to manage the influx of deliveries. We encourage residents to remain in their suites and wait for their packages to be delivered. However, if you choose to come down to accept your package, please ensure that you wear a mask and maintain 6 feet distance between yourself and others, including the family or friend you are meeting. We at Canterbury Foundation are here for you, and like you, want what is best for the residents who call Canterbury home. These past 3 months have not come without personal and emotional cost to you, as it has for us. We have asked ourselves and our staff to govern themselves when they are not at Canterbury, to be vigilant about their actions in wearing masks, maintaining 2-meter physical distance, and sanitizing their hands frequently, observing all public health measures to protect themselves from contracting COVID. Because Canterbury is not considered long-term care or designated supportive living, for the measures that we have put in place in terms of additional staff and other precautions to ensure the safety of residents and staff, government funding is not available to us. As much as possible and as quickly as possible, we have responded to requests and direction from the Chief Medical Officer of Health orders for licensed supportive living facilities. We realize that there is a level of frustration from families and residents due to these precautions. We have seen firsthand how difficult this has been for all of you. We will continue to work with you as we can within the resources that we have to loosen restrictions at the right time in a safe way. Please be patient as we have your best interests in mind. This is our relaunch plan. Again, we thank you for your continued cooperation and patience. We know that this is a difficult time, and we want you to know we are here for you. If you have any questions or concerns, please ensure that you call our COVID-19 hotline at 780-930-5580 or email community@canterburyfoundation.com. Thank you.
Thank you so much, Wendy. We're going to start the Q&A portion of the evening now tonight. You do have the opportunity to ask questions of Wendy and Heidi Amambalia. Most of you should know who they are already. As well, I just want to mention that the town hall is being recorded tonight. So if you didn't get a chance to, or didn't catch something, you can go on the Canterbury Facebook page and you'll be able to see this town hall after this as well. We encourage you to share it with any family members who wanted to participate tonight but weren't able to. So I'm gonna ask Heidi the very first question. It is, do the Canterbury relaunch strategy phases align with the Government of Alberta relaunch strategy stages?
Thank you, Kat, and welcome everyone. I'm assuming you can hear me. We're just testing our mics. Good. Thank you. So I appreciate the first question. The Canterbury relaunch strategy doesn't entirely align with what we see as the provincial relaunch strategy. As we've heard repeatedly from Alberta Health and from Dina Hinshaw herself, the most vulnerable population is our continuing care population, which of course includes Canterbury. And so with that, we have specific orders that have been set out to have our types of facilities follow in order to ensure the higher level of protection that is required. Having said that, we do have the opportunity with the latest orders to introduce some phased opportunities to relaunch some of our activities, some of our increased visitation. And the piece that does align with the Alberta province in their strategy is the fact that what they will be looking for to reintroduce, and I know these will be questions coming into the evening, reintroduce opportunities for things like visitation and greater opening of facilities will be the similar types of things they're looking for as we move towards stage 3 in the Alberta plan. And that would be that we see a lower threshold of active cases in Alberta, the cases in hospitals and ICUs being reduced and maintaining consistent. So the sorts of things that they're looking for as they move to the stages of the Alberta Relaunch Plan will be the sorts of things that they will look to determine at what point they can further open up the continuing care plans, and that are the orders that we are obligated to follow. And, so I think the thing we've determined is that they in the province have called them stages, and you'll notice we've called them phases just to designate that they are a little bit different.
Okay, thank you so much. We have another question. This one is from Janine. With the restrictions lifted for leaving the building, residents can leave for non-medical appointments even though it's not recommended. Can anything be done if the family doesn't want the resident leaving the building, even though they may want to go out? Wendy, do you want to take that one? And I don't know, Heidi?
Certainly. I guess that question will depend on the resident themselves and whether they have the ability to make their decisions. But I would suggest that there would be a conversation with the family and the resident about that. And I'm sure that we can work together to help the resident to understand the risks involved in them leaving, and so that everyone can be happy with the decision. And that's generally how we would handle the situation like that.
Okay, thank you.
Good question. Good question.
That was a good question. Okay, next one.
Sorry, Kat, can I just sneak in there? It's Heidi. What I would encourage, if there is a scenario like that for any particular family, please do feel free to reach out to our health services team so that we can make note of that and ensure that any of your concerns are accommodated, and that we're able to make note of that and work together for the resolution.
Okay, thank you, ladies. Our next question, why does an essential visitor and a guest have to visit at the same time? And will later afternoon or evening hours be added to the outdoor visitation schedule? Mambali, do you want to take that?
Yes, I think that one's for me. Thank you for that, Kat, and thank you for the question. I think initially when we started the outdoor visits, we were really working in accordance to the guidelines set by the Chief Medical Officer of Health, which required that the essential visitor be present along with the additional guest. Since then, we have realized that this was presenting as a challenge for families, as there are many different scenarios where this was not possible. So we have made an adjustment to that requirement. As of June 1st, we are no longer required that the designated essential visitor be present with the guest, but we still want that family member to be the one to book those visits, because that is the only way we are able to track and to make sure we have the contact information should we need to engage in any tracing activities. And that also allows that family member to really also work with us to ensure that whoever is taking their spot or whatever guest that they're inviting for those visits are able to maintain all of the precautions we have in place and follow all of the guidelines. And for the second question about later afternoon and evening hours, we are currently evaluating that process as we speak. We have expanded the outside visits to include the weekends, and right now the times are from 10 o'clock to 3 p.m. And those times have been selected to ensure that we have the staffing capacity to be able to facilitate these visits, as well as the monitoring requirements, which is stipulated within the order. We do plan in the upcoming stages to be able to further make decisions as to whether or not later times can be opened up. And what we want to do is we will send out a quick survey to the family contacts to make sure that we get a better sense of what that time would look like. So expect to receive some more communication from us as to what that would look like in the next few days.
Thank you so much. Okay, next question. Up until now, Canterbury has been protected for residents. By loosening restrictions, do you feel we'll be more vulnerable to a possible COVID case? Wendy, do you want to answer that?
Certainly, thank you for the question. That as well, these are all great questions. And for this particular one, there is always a risk. What we want to do is to ensure families and residents understand what those risks are and work together with them to ensure that they protect themselves as much as possible. I think that, you know, some people may be more risk tolerant than others, but however, we must maintain vigilance that we are keeping everyone safe, including the residents who want to go out into the community, as well as those who choose to stay within Canterbury. So we want to work with everyone to ensure that we are as safe as much as possible and practice all of the restrictions that we have put in place for phase 1, which will continue into phase 2 and into phase 3. Thank you.
Thank you. Okay, the next question is from Chris. Did you say that external companions will be allowed in phase 2? And if so, what details could you share about that? Also, they said we're doing a great job. Thank you.
Thank you.
I'm not sure that that question was directed at any one of us, so I can respond. We actually identified that as being part of our stage 3, and it would be aligned with the opportunity, as Dina Hinshaw announces, for continuing care facilities, that we are allowed to have visitors inside the facility. That is the opportunity to expand the external companions, as well as the external housekeeping services that may be part of your loved one's care. Having said that, we also do have internal companion services that are available through this time. So if there are any questions, please don't hesitate to reach out to Mbalia at our Life Enrichment contact information.
All right, thank you very much. When will you start having entertainers back at Canterbury? Mbalia, do you want to answer that?
Sure, I can take that one. Currently, we have the internal entertainment, again, tentatively planned to start in stage 3, because that would also align with us opening up our doors for internal visitors. And it would also allow us to be able to have vendors as well as multi-faith leaders coming into the building. So we are taking into consideration the maximum number of people that would be allowed at that point in time to congregate. So even when entertainers come back in, it may be limited as to how many people can be in a particular entertainment program. We have, however, started discussing within the Life Enrichment team how we can facilitate external entertainment, especially with the summer months coming and the weather getting nicer. We do have some courtyard spaces externally of the building. So we are actively working right now to see what we can do to be able to create some opportunities for musical entertainment for our residents. So I think we can plan to see something like that happening in late July or August.
All right, thank you very much. Something to look forward to. Heidi, this one is for you. When will you be opening up Canterbury Court for immediate family members to visit?
Thank you, Kat. I know that is one of the burning questions this evening, not just related to the court, but certainly to the manor, the court, and the lane. As I think we've alluded to, our restrictions currently are aligned with the orders that are in place, the public health orders that are in place from the Chief Medical Officer, Dina Hinshaw. This relaunch strategy actually came on the heels of a recent order that was released about a week and a half ago, order number 23. And unfortunately, we have not seen any changes at this time to indoor visitation. And so my answer to that is that we are awaiting the changes to those restrictions from Alberta Health, and the Chief Medical Officer of Health. The good news, excuse me, that I can provide is that as recently as this afternoon, when they were announcing the province going live as of this Friday with stage 2, Adina Hinshaw herself acknowledged that she is in the current process of reaching out and trying to get the opportunity to speak with family members, residents, and us as operators to determine what this next stage needs to look like in visitation, in terms of visitation. And typically, we know that when we hear that that consultation is starting to happen, we start to see the change in orders within a couple of weeks. So our best guess at this time is that we will potentially see some opportunities in early July, and we're hopeful to be able to work with yourselves and our team to be able to make that possible as soon as Dr. Hinshaw gives us the go-ahead.
All right, thanks very much, Wendy. This one's for you. How can we justify keeping residents at Canterbury when the province has already started reopening?
Mm-hmm. So thank you for that question. I totally understand why you'll be asking that question. It's very similar to the question that was asked previously based on the restrictions or the relaxation in the community, and is there going to be any risk to our residents? And that's basically what we're concerned about. At this point, the Chief Medical Officer is saying it's okay to go out into the community. However, it's not recommended. It's better for our residents, who are the most vulnerable population, that COVID-19 does impact and can have very serious consequences. To remain close to Canterbury and to remain at Canterbury is the best. However, if they need to, they can go. And we would encourage them to ensure that they follow the precautions that we have put into place, and as well as anyone who is taking them out, driving them, accompanying them, that they must also observe those precautions. So we hope that by everyone doing their part, that taking this seriously, that we have precautions to observe, that we can prevent COVID from impacting our residents. Thank you.
Okay, Heidi, this one's yours. Several questions have been asked regarding the ability for an out-of-town family member to come and stay with a resident over the summer months. When are these kind of visits going to be allowed again?
Sure, thank you, Kat. I think I need to refer back to my previous response as it relates to visitation. Certainly to be able to come into the facility and stay overnight, stay for an extended period of time, falls into that same category as visitation within Canterbury. So we are at this point still waiting for the opening of that opportunity from the Alberta Health government, as well as Dr. Dina Hinshaw, and we will promise to and commit to staying in touch with our residents and their families along the days and weeks to come. As these orders change, we will be updating our information, our relaunch strategy, and as soon as we are able to introduce these types of visits, we will certainly do so. So I am hopeful that sometime over the summer, those that I think some of the questions indicated that there's August visits, certainly Christmas visits that are planned or hoped for. My hope would be that we would be able to accommodate that. Please stay in touch with us if you have individual questions, and watch for communication coming forward as we're able to open that visitation up more.
Okay, thank you so much. Mambalia, why is the coach not allowed to go to businesses now that the province has reopened?
I think just along the same lines as what Heidi has said and Wendy has said, you know, our residents are the most vulnerable, and we want to make sure that we're taking every action possible within our control to make sure that they are safe. And right now, with the majority of our residents being able to source their supplies, either that they need either independently or through family or through the store delivery that we have with IGA, the use of the coach is for business attendance. It's not really as needed as it was prior to COVID. Right now, what we're seeing is once the coach transit opens up, the primary need for that will be for leisure drives, especially for our residents living with a dementia, to be able to have a change in scenery and to have a different environment that they can participate in. So that's where we are finding the need once we start our coach outings. And we also will be limited to the amount of people we can have on our bus, particularly because of physical distancing. So all of those things in consideration are some of the reasons why we will not be stopping at businesses at this time.
Okay, thank you so much for that. Heidi, this one is yours. When will the Canterbury physicians be allowed back on site for appointments? And will the nurse practitioners be able to request blood work and similar tests? By the new provincial guidelines announced last week.
Great, thank you. That's a great question. I think there's a couple of different pieces to this, so I'll answer it broadly. Certainly at this point, physicians are allowed back on site. We have, of course, those residents that have internal physicians that are attached to Canterbury, and we've been in close contact with our physicians along the way as needed. They have come on site, although limited, just for precautionary measures. We've done most of our visits through video conferencing as possible at this time, just to add that sense of, add that precautionary level. Other external physicians that are wishing to do house calls to Canterbury site are able to do so. We would request in those cases residents or family members reach out to health services just to let us know or to coordinate with us, because it does require when the physician comes on site that we do screen them and make that an accessible appointment. So because it does require some of our resources, we just ask that we are able to, have the opportunity to coordinate that. But certainly physicians as well as nurse practitioners are allowed on site. In speaking to the question about nurse practitioners, as a nurse, I am thrilled to see the enhanced scope of practice within long-term care and designated assisted living for nurse practitioners to practice to full scope. We are not, however, one of those sites. We are not long-term care or designated supportive living site with funded beds, which is that announcement referred specifically to those scenarios. We do have one nurse practitioner that does work within our physician team, and she certainly has the ability to order blood work, lab tests, practice to full scope. That's never been in question, and certainly if we have the opportunity to introduce more nurse practitioners, I would welcome that with open arms. However, at this point, as a private facility, that's not part of our particular program, but certainly happy to see that in the future.
Okay, thank you so much, Heidi. Wendy, I have a question for you.
Mm-hmm.
Has Canterbury Foundation received any government funding to help with the costs around COVID?
Thank you for the question. As we are not considered a long-term care center, we are not considered a designated supportive living site, nor a lodge. We are not eligible at this time for any funding which has been announced by the provincial government. So at this point in time, no, we haven't received any funding whatsoever to help with any costs. Although we are tracking costs, we are hoping that we will be able to at some point be able to get some funding, but at this point there is nothing available to us. And thank you for the question.
Much fundraising coming in the future.
Yeah.
Okay. Can you please explain the decision to do temperature checks, screening for residents who have left the facilities for a few hours? There are no reports that someone can contract the virus and have symptoms in this time frame. Would it make more sense to do these checks when we know symptoms appear? Heidi, do you want to take that?
Sure, thank you. It is, I hear my colleagues laughing in the background a little bit. It is a challenging question, and it's an excellent question. It's certainly something that I personally have questioned the Alberta Health team that put that order into place, because I agree, we're not necessarily going to see someone leave the building within an hour and come back and present with symptoms. Having said that, I think their perspective is that as they loosen up the restrictions, they then need to tighten the screening and feel that we are keeping a closer eye on any potential for symptoms. And we also have to remember and recognize that the Alberta Health government branch is making recommendations and policy for a number of different types of facilities. So it has to be a bit of a one size fits all. And so they're trying to catch as much as they can with these recommendations, knowing the various different environments. So having said all of that, I think what's important to know is that we are committed to enhanced screening overall. Many of the residents that are receiving day-to-day home care services are automatically screened every day, including temperature checks, whether they've left the building or not. Certainly, we are encouraging and helping any of our independent residents that may require, we are always available, anyone that may require some assistance with their self-screening or want to have a screening done are able to request that through our staff at any time. And so we just need to consider this an additional check, an extra precaution, recognizing that as things loosen up, at least in these initial stages, everyone feels a little more assured if we're keeping a close eye on that. As Wendy spoke to earlier, we are doing everything that possible to ensure that that is a quick and painless process for residents, that they aren't standing in lines and waiting. It should be something that is just a check-in on their way by, or if they've had their hands full of things and head right up to their suite, a simple phone call to us, we can send somebody up. We are trying to make that as you know, both as quick and painless for you, the residents, but also take that precaution seriously. It is one more opportunity for us to just do that double check, to engage with you as residents and ensure that the precautions are being taken, and that there aren't anyone presenting with symptoms. Alberta Health did indicate to me that one of the factors in considering that was they have in the past caught symptomatic residents in that screening process. So they are leaving that in place for now, and we will keep you posted. And we just appreciate your cooperation and patience as we work together on that requirement, which is one of the order requirements that we are required to follow.
Okay, thank you. I think this is also yours, Heidi. How are you managing staffing for increased need for medical and non-medical companions?
Well, that's, I certainly need to acknowledge Ambalia as one of my partners in companion care. We have been able to expand our healthcare aid staffing to assist with the companionship, both medical and non-medical. As you can imagine, during these times, we have had many of you, I'm sure, have heard about the single site worker scenario. So some of our resources have, in terms of our staff, for example, casual staff have changed. So a lot of the staff that have positions with us have stepped up and been willing to take on extra hours. They know the residents and are familiar with them, and we try to, as best as possible, match personalities and familiarity to our residents, as we've had to take on some of that companion care and had increased requests for companion care, given the fact that families just haven't been able to be there in the ways that they have in the past. Additionally, I know Valia has been in the process of recruiting more companions that would be employed by Canterbury and specific to our site to be as safe as possible in that process. So it's been a many-pronged approach. We have relied on our current staff and have tried to expand our capacity to do that, to ensure that the needs of our residents are being met and that the best matches are able to happen in terms of matching our companions with our residents.
Okay, thank you. Wendy, I have a question for you.
Mhm.
Is Canterbury Foundation accepting donations, and is there specific things that Canterbury requires?
Mhm. Thank you for the question. Yes, we are. We do have a donation page on our website. Would encourage you to look at that. At this time, we do have a campaign for helping us with the costs associated with COVID. So we would appreciate any assistance that people can provide. And we do really very much appreciate the support. Thank you.
Is there donations for items such as masks and things? Is Canterbury looking for any of that?
Yes, absolutely. We have been very fortunate to have had our vendor partners and other organizations in the community that have donated masks. And we certainly appreciate those, because we need to, all of the staff need to wear masks every day and change throughout the day depending on the tasks that they are performing. And as well for residents, we are encouraging them to be masking as well. So, and donations for masks, donations for other PPE items are also very much appreciated.
Kat, it's Heidi. I'm just seeing a quick follow-up question to with regard to external physicians as to whether or not they require an in-person visit at Canterbury, or if they're able to see their physician off-site for an appointment. Certainly, if there are specific questions with regard to that, family members or residents can reach out to health services for some guidance. But overall, I know that community physicians have taken particular precautions to minimize, excuse me, I'm losing my voice, to minimize the interaction, patients being in the waiting room, for example, taking precautions as it relates to wearing masks and having hand sanitizers available, and the way that they are having visits. So if there is a visit to an external physician that is required, we do consider that to be a relatively safe and essential visit to have. So residents are welcome to visit their physicians in community if they need to follow up with regard to an appointment.
Okay, great, thank you. Our next question is from Kay. Are physiotherapists able to come in for treatments? And maybe we can talk about some of the external sort of medical folks that come into Canterbury along with that.
Thank you, Kat. I think I'll start with that, and then I may invite Valia into the conversation, as I know a lot of our external providers for a number of services engage through our life enrichment team. Physiotherapists in particular are still under the category of so that particular group has just relaunched starting in stage 2. So they haven't even opened fully yet to the province until I believe this Friday. And I apologize if I'm incorrect on that. Regardless, that list of essential visitors still has some particular precautions that we have to follow as it relates to being able to come into the facility. those include things such as not having visited another site prior to entering into Canterbury, so they can only go to one site a day, and they are not able to go from suite to suite. So those particular types of services, such as physiotherapy, massage therapy, that people might be interested or think could come into Canterbury, I would say on an individualized basis, please contact Health Services for the most up-to-date information. But I will let Ambelia speak to where we're at with some of our other services as it relates to the relaunch strategy.
Yes, thank you, Heidi. And for those kinds of services, we usually have optometrists that would come to Canterbury. And even with that kind of service, they are still slated to be in the phase 3 of our relaunch, primarily because of the restrictions that we currently have in place, or that they have to also follow. So the optometrist being open to the public, he is less likely to come into our site at this time until there are more opened up sort of guidelines for outside visitations. And I know that foot care has started, and that is being done through Health Services. And right now it is restricted to one of the more immediate needs that the residents require, and those are being done on an appointment basis, and those can be facilitated by contacting the nursing station should you have a family member who requires those kinds of services.
Okay, thank you. Mambalia, while I have you, I think this one's yours too. What is Canterbury's approach to prevent or address the risk for isolation or mental health issues for residents?
I think that is certainly social isolation as well as mental health issues are very important for us, and they are at the cornerstone of all of the programming that we facilitate within Canterbury and within the Life Enrichment program. And since COVID had started, we have made sure that we're still able to engage with our residents, even with the restrictions that we have in place. So programming did not completely get canceled. We still were able to maintain small group activities. We made sure that things like exercise programs were still being held, and we even increased those kinds of programs within our lane in our dementia unit. We ensured that there's a lot of opportunities for even the healthcare aides to interact with our residents, making sure that they are able to do things like ball toss, discussion groups. For the manor as well as for the court, we have increased our capacity for virtual phone calls, as families may have participated in. So things like FaceTime, Zoom, Google Hangouts. We're doing a lot of technology assistance for residents. So our programming has shifted a bit, but we certainly are making sure that we are able to engage residents to the best of our abilities, even with the restrictions that we have in place.
Okay, thank you so much. Heidi, will Canterbury plan to screen guests at the main door once indoor visits are allowed? And would visitors be responsible to bring their own face masks?
Thank you. Great question, Kat. Yes, absolutely. The expectation as it relates to screening is, of course, that as soon as someone enters the building, they are being screened, including a temperature check. I don't have, of course, as I've mentioned, the orders that we anticipate from the Chief Medical Officer of Health as it relates to what internal visitation will look like. Having said that, if we look to what they've put in place for the external visits, at this time, the visitors are required to bring their own mask. So and having said that, I would be prepared for either scenario to occur, and we will certainly keep people updated once we have that information as to the requirements on their behalf prior to any visit.
Okay, thank you. Wendy, I'm going to throw this question at you because you haven't talked in a little bit. And then maybe Heidi can come in on the backside.
Of course.
Alberta Health Services has recently recommended that everyone in the province be tested for COVID-19. Will Canterbury have all staff and residents tested under this recommendation?
Thank you for the question. We think it would be very important for all staff and all residents to be tested. At this time, it is being offered to long-term care, designated supportive living facilities. And we would be reaching out to Alberta Health Services to determine whether that opportunity would be able to happen at the Canterbury site. Although at this point, we don't know the answer to that. However, we do encourage all residents and staff to do that. That would be important. I don't know, Heidi, we were talking about that today. Anything else that you want to add to that?
Sure, thank you, Wendy. I just, as Wendy acknowledged, I want to just point out that the sites that had outbreaks were prioritized for testing, and of course that makes sense. And then secondarily, the long-term care and designated supported living were the next level of sites. And we are trying to, at this time, partner with Alberta Health Services to look to see if we can be access on-site testing. Our preference would be to have residents be able to be tested on site versus them leaving site, which of course increases any level of risk. So we are trying to have Alberta Health Services partner with us to come on site and provide that testing. As it relates to staff, the invitation to them, as with every other member of the province, has been extended, and we do have some staff that have already pursued that and have reported back to us, and we are continuing to encourage our staff, as is the Chief Medical Officer of Health, encouraging all Albertans to go and get tested. The excuse me, the only other thing I will point out as it relates to that is that we just need to keep in mind that that is a point in time capture of whether there is a positive result or not. So even though Wendy may test negative today, in 5 days from now, she could go on to have more of that virus in her system, present with symptoms, and still be COVID-19 positive if she had been exposed. So we just need to keep in mind that it is a point in time testing. Not to say that it's not worthwhile and important, and we are pursuing that, but we just need to remember that it's not a guarantee for the future.
Thank you so much, Heidi. Wendy, how often are residents who live alone checked on for overall well-being, and are there protocols to check on independent residents?
Thank you for the question. So for those residents who are receiving home care, of course, they're seen and have interaction most days with our staff, particularly those who live in the court. The residents who live in the manor, there is not so much the opportunity to have daily interaction with our staff. And so some of our staff have participated in a program where they do the friendly neighbor program, where they do check on each other during the day, each day. And oftentimes when our staff are providing care to other residents or providing housekeeping services to other residents, they will notice, for example, whether a newspaper is outside of a door. We do have staff that do care that much, and so they do check on residents. And we do have a receptionist in the manor who is there from, I think it is 7:45 till about 9:30 every day, 7 days a week. We've implemented that during COVID, and they do notice whether whether they've seen people. But for most residents who are independent, they choose to be independent, so that's their choice. And so we have to respect that. So in the manor, it's a bit different than it is in the court.
Okay, thank you. Heidi, this one is yours. Why do residents need to wear masks during visits with loved ones? What is being done for residents who are hard of hearing and use lip reading as a form of hearing and can't do this with mask wearing?
Great questions. And I've also been made aware that there's a little bit of an extra question there that had been sent in previously that I'll address as it relates to mask wearing. It's interesting, of course, a big question. Many will note that the top docs in Canada were, sort of initially saying, no, don't need to wear masks, and then they all changed their mind. Of course, we are learning as we go. We are using the most up-to-date research and science as it relates to learning about COVID-19. And even though there was a change in recommendations, it is quite clear now that certainly the wearing of masks is a protective factor. It does help lessen and prevent the spread of COVID-19. I don't know off the top of my head as it relates to non-medical or cloth type face coverings, to what extent it protects the person wearing them, but certainly it's been determined that it does prevent the spread. In Canterbury, residents, you will notice that we, for a number of weeks and at least a couple of months now, have all been wearing our masks when we are out in the common areas. We are wearing medical grade procedural masks. Those masks act to protect both the person wearing them as well as those that they are in closer proximity to. So it is an added layer of protection. Also why we have asked our residents to wear them, even though family members may be wearing their masks. For outdoor visits, for example, there isn't a requirement for medical masks. You're able to bring your own face coverings, cloth masks, that sort of thing, for just that enhanced protection. We have provided the medical masks for residents to wear to ensure their safety. And again, these precautions, we were having a conversation earlier today about the fact that many of these precautions, as challenging as they have been in the past number of weeks, they have got us through certainly the heightened stages and the peak times when the cases were at their highest and the spread was at its highest in Alberta. So those precautions really were to make sure that everyone was as protected as possible. The issue as it relates to being hard of hearing and reading lips, we know that is a common concern. We have addressed that in a number of different ways within the facility. So many of the window visits, we're using whiteboard communication where people can write messages and hold up the whiteboard. We've instituted that as well in our dining rooms where our serving staff have to wear face coverings or our medical masks to help to communicate with our residents that do have difficulty hearing. And I don't know that we've put this in place, but when this question came across, it certainly makes sense for us to have those boards available for in-person visits, for outdoor visits, or as the new orders permit, once people are able to start to come into facility and will be required to wear masks, that we have whiteboards accessible for use for hard of hearing individuals, because that is an absolute challenge. But at the same time, it is important to have that precaution in place and to put safety first, unfortunately. I guess fortunately. Sorry.
And I can just speak to the use of the whiteboards for the outside visits. In particular, when we've had families book those visits and they are visiting with a loved one who is hard of hearing and they've notified us, we have made sure that we have a whiteboard on hand if they don't have one of their own, so that we can help facilitate those kinds of interactions. So any of those assisted devices we're able to utilize. Another thing that we are able to utilize as well is our iPads, utilizing sort of the speech to text app on the iPads, which allows for the family to be able to speak close to the iPad, and then the loved one would be able to read and communicate that way. So we are really looking at really interesting and unique ways of facilitating those interactions without mitigating the need for them to not wear the masks.
Okay, thank you so much, Mambalia. Wendy, this question is for you. Up to this point, residents who go out for a walk are asked to stay on the sidewalk on the perimeter of the complex. especially with the construction along 142 Street and on 85th Avenue. Is this still the case? And would walking a few blocks away from the complex be of concern, particularly if physical distancing is maintained?
So thank you very much for the question. So we do still suggest and strongly recommend that our residents stay on Canterbury property. We do have residents though who it has been their practice to walk further into the community. And so as long as we say to them, as long as you are practicing physical distancing, you are wearing your mask, and you report into reception and you report back, this can be allowed, but we need to ensure that they are being safe.
Okay, thank you. Heidi, regarding quarantining for 14 days after an outpatient procedure, please confirm regarding outpatient procedures at hospitals.
Great question. Thank you for the question. I just want to clarify, I know in the interest of Wendy trying to briefly run through the changes to the restrictions, we didn't acknowledge all of the different scenarios in that introduction as to where isolation precautions would be required versus may not be required. So please do refer to the document that was sent out. It does specifically speak to many of the scenarios. However, I do realize that outpatient was not one of the ones that was highlighted. And so what the guideline I would let people know they can expect or refer to is that if there has not been a hospital admission, an overnight stay, an admission to a unit, then they are not required to isolate upon return to the facility. Isolation is only required if they have been admitted, whether it's related to a COVID illness or even a non-COVID illness. And I will point out that there is an additional note at the bottom there that even though we do encourage and offer testing upon return or even prior to returning, it doesn't negate the requirement for that 14-day isolation period. And that goes back to my comment earlier about the fact that that is a point in time snapshot of their COVID-19 status, and that we can still see people within that 14-day period go on to actually exhibit symptoms and have COVID-19 and become COVID-19 positive.
Okay, thank you. And I think this is our last question. So for those of you still joining us, if you want to send in one last question, now is your time. Okay, Heidi, page 4 of the Canterbury Relaunch strategy has a listing of resident outings that would be allowed but not recommended, such as banks, hair salons, and restaurants. This is fantastic as the province starts to allow some personal freedoms, but it seems risky. Does the resident's essential person need to be the ones taking them on these outings if they don't drive themselves?
Okay. Thank you, Kat, for that question, and to our family member that's obviously asked that question. I think it's an opportunity, as this is potentially one of our last questions of the evening, just to pull together a couple of the themes that we've talked about so far. We've heard the idea of riskiness in this question. So, again, as we make decisions, whether it's someone that's personally able to make that decision or with some of our residents where family members might be the decision makers or more involved, the decisions need to be based on understanding what level of risk that is. Those that are over the age of 60, we've identified are at the highest risk of severe outcomes as it relates to COVID-19. Certainly those with additional comorbidities or health issues, that adds to the risk. And again, I just want to point out that one of the things we've talked about tonight is that we certainly have residents that are eager to get out and be more involved in the community as things start to open up. We also have a number of residents that appreciate and feel much safer in Canterbury, recognizing the many safeguards and precautions that are in place. And as individuals making decisions, we need to recognize that we are acting individually, but our individual decisions do have impact on our Canterbury community. So we just ask that you take all of those considerations into regard as you make decisions going out into activities out in the community. If for someone that does require family support in making those decisions, we certainly welcome the designated essential visitor or any sort of alternate decision maker legally that's in place to be involved in that decision making. And if there are specific concerns, if you want the ability to have information on our medical record that indicates your preferences as a decision maker, please be in contact, with us at Health Services so we can make sure that those wishes are understood and we can put those things into place. I hope that answers the question as it was intended.
Okay, you have one last question. Heidi, do you have any requirement or expectation that staff or visitors utilize A/B Trace Together on their cell phones?
That's a great question. At this point, we have not gone as far as to require it. However, I feel like I need to hold up my cell phone and say, I have it on my cell phone. I have personally recommended that. We have had our IT team speak to the safeguards, the safety of that being on their individual cell phones, and certainly have encouraged the use of that application. I do encourage certainly family members, residents, our staff to go ahead and download that. It is a Bluetooth activated device or app, I should say, sorry. So it doesn't work based on GPS. It's not a Big Brother type of application. It only activates when it's in close enough range of another Bluetooth device that has the app, and it tracks any less than 2 meter contact in a 24-hour period that it totals up to 15 minutes in that 24-hour period. And it has been and proven to be very effective and time efficient for our public health teams to be able to do contact tracing. In fact, just today on our daily leadership team COVID meeting and update, we had someone report back that their own father had been contacted and made aware over the weekend that they had been in contact with someone. So we are seeing it work, we are seeing it in action, and so we do strongly encourage our staff to take part in that. And like I said, I would encourage all of you listening tonight to please go ahead and download that app.
Okay, thank you so much. Before I wrap us all up and close, Wendy, do you want to say anything to sort of sail us off here on our town hall?
To sail us off, certainly. So I just wanted to say thank you so much for giving us the opportunity to talk to you about our relaunch plan and the opportunity for us to respond to your questions. We very much appreciate that you have taken the interest and that you care so much and about your loved ones, and giving us the opportunity to be able to share with you how much they are important to us as well as are you. So we do hope to see you soon in person as much as possible in a safe way and as soon as we can do that. So thank you very much for attending tonight.
We miss you too as much as the residents do.
All right, ladies, I want to thank you so much for doing this, and I want to thank all of our participants tonight for logging on and asking your really awesome questions. I do want to remind you that we are recording this tonight, so we will be putting it on the Canterbury website and then sharing it out on our social media platforms. So please share that with any of your family members who wanted to participate tonight but were unable to. I think that's all for us tonight. If you have any other additional questions, As you sit and think about what you heard tonight, you can email them into community@canterburyfoundation.com. Thank you all so much. Have a good night.
Thank you.
Bye-bye.
Thank you, everyone. Bye-bye.
Thank you,
Thank you.
everyone.
Bye-bye.
Thank you.